Good morning, everyone. I hope everyone had a wonderful weekend. And it's really exciting. Today we're going to be talking with Dr. Doris Day, who is a dear friend and colleague. And I've known Dr. Day for over 20 years. She is a medical... Here she is. Let's see. Let me invite her here. There she is. She is a dermatologist to the stars and a phenomenal medical Hey, how are you?
Good. Let's see if I can fix this a little bit.
Good to see you.
Good to see you too.
Okay. I was trying to rave about you, and then you interrupted me.
Wow, that's what I do. I'm trying to figure out the right lighting here so I don't look weird. That's too dark. That's too light. We'll figure it out. All right. Well, it's what it is.
Well, good to see you. Will you just talk a little bit about everything that you're doing in terms of your radio show and all the amazing work you do in terms of educating colleagues and especially I want to talk to you as we get further in about your book and I just love the concept behind your book. It's called Beyond Beautiful and it talks about the interaction between the mind and the skin.
Yes.
And that it's more than just skin deep. And I think this is a really important subject. You know, I was listening to a podcast recently about a colleague, and they were just kind of focused on kind of the superficial aspect of how we perceive ourselves. And for you, somebody who's been doing a syndicated radio show, how many years have you been doing it now?
12 years.
12 years. So, you have incredible insight into how people perceive themselves.
Well, you've been on the show from the beginning. So I love that, you know, it started out, I think, I'm just a year ahead of you in training, but I started as an attending when you were in your third year of residency. And so you used to come on as a resident, and then you've come on tons of times. And it's always one of the most popular shows. We get so many calls when you're on, and our listeners love your insights, especially when we talked about the laser work that you've been doing for childhood vascular anomalies. So that's been amazing. And your book is amazing too, by the way, if everyone hasn't read it.
Thank you. So can you just talk a little bit about how you know, based on your years of doing a syndicated radio show and all the experience you have as a practitioner, the role of the mind and how we perceive ourselves and how we can, you know, in addition to all these incredible breakthroughs that you and I are so fortunate. I mean, we talk about this on the show all the time about how lucky we are to be practicing right now. I mean, if you think about it, you know, when we were coming out of our training, Botox wasn't FDA approved. None of the fillers were approved. The Fraxel laser had never been heard of. I mean, the pulse style laser was being fine tuned. I mean, it's I mean, our timing couldn't be any better, but there's more to it than that. And when you're interacting with patients and how do you talk to them about how their self-perception as well in terms of what you're able to provide them?
Yeah, what you're saying is spot on. And what's happened is that we're really in the infancy of our understanding of the aging process and the value of appearance. So it used to be that we would just have these temporary collagen-based fillers that would just erase fine lines and wrinkles. And we didn't really understand. I mean, we think about anatomy and how we studied in medical school versus how we study anatomy for the aging face now. And it's incredible. You think that we haven't changed that much, but our understanding of what's happening decade by decade, year by year as we age has changed. So now we understand it's skeletal, it's muscle, it's fat, it's skin, it's ligaments, all aging at different rates based on genetics, lifestyle choices, external factors, so many different things. And then we also understand as we get that, and we see that when we make these structural changes in our patients, sometimes they're better and sometimes they're not, right? And that has a lot to do with their perception of themselves, why they come in asking for what they do, why they see themselves the way they do. And unless we can help them make that connection between what they see and what they feel and have that match, both our vision and their vision, we're not really going to make them more beautiful or happier. And ultimately, the goal is not just to make our patients look better, but to actually make our patients better and to live better lives, to make better choices, to be more fulfilled and happier, to be more confident, because all of that feeds into beauty. And so what we do is essential. It may not be the same as what we're seeing in the hospital. I point to NYU right behind me. It's not essential in terms of in this moment being life-saving, but you know what, it's also not frivolous, and people really do appreciate the value of appearance. Whether or not you do a treatment is not really the point. The point is knowing that what the face and the impression you put forward is connected to how you feel, and what we do is we try to help them make that connection as positive as possible.
So you may not be aware, but my sister's a dermatologist. Did you know that? Yeah.
I did. I think that's awesome.
So she's also a patient, and it's interesting because when she'll come in, I can coax her into visiting us in Houston, you know, whenever it's time for a treatment. And it's interesting because she'll talk to me about how her patients perceive her, or how she feels like her interactions with other people will change after she receives a treatment. You know, she talks about how, you know, my sister really takes care of herself, but she says, you know, being postmenopausal, the effects of on the lower estrogen on the skin has had an impact. And so all those things you were talking about in terms of what we're able to do in terms of restoring some of that lost volume and that lost collagen and elastin. But it's interesting because she even comments about how people relate to her when she goes to the checkout counter at the grocery store before and after a treatment. I mean, so how much of this is based on how the interactions that we have with that what we're able to do is helping people with that?
You know, I wonder with your sister, because I mean, we're all patients too. We're all if we're not patients of our own work, then there's a real problem, right? Because if we believe in it that much, I believe, you know, we're all aging, and having it done is important. I'm also a huge fan for the right candidate of hormone replacement therapy. I think it's gotten a very bad rap, and I think that in the future, hopefully in the near future, we'll see it as malpractice not to educate women better on their options with hormone replacement. It's not for everyone. And I don't do it. I don't prescribe it. I just send patients out to doctors who follow that. But I think that the Framingham study was one of the worst things that happened to women, because it made women afraid of certain foods and also of hormone replacement, when I think it saves lives and saves your skin. And if your skin's aging differently after menopause, the rest of your organs, your brain, your bones, everything else is as well, right? Your skin doesn't age in isolation without estrogen or without that hormonal balance. So I think it's very protective, and hopefully that'll be part of the conversation, which leads to the same thing of looking better means being healthier in both physically and emotionally. And I also wonder with your sister, what I was going to there is that when you get the treatment done, you actually feel prettier. And when you go to the store, you may just make more eye contact or smile a little bit more. And so people treat you differently because of what you emote and what you project. And even though we know better because we do the treatments, right, we still feel it. I mean, when I get something done, or my neuromodulator, I go out and I know that I'm emoting, I'm feeling a little bit better. So there's that connection. And that's why it's really important to see a trained aesthetic injector. I think board certified dermatologist or plastic surgeon doing the injections, who can properly assess you and properly help you understand what the goal is of the treatment. The injecting part isn't always the hardest part. The hard part is the assessment of understanding the patient, understanding their structural anatomy, how they're aging, what their proper balance is. Because we're not making somebody necessarily look younger as the end goal. We're helping them look beautiful and balanced, right? And to understand what this process is. So this is, even as we head out of this COVID, it's really not about bargain hunting or cutting corners. It's really about having a relationship with a trained aesthetic physician who can help assess you properly, help you reach your goals. And that is over time. It's not a one visit to one visit thing. It's a journey. Right. That's why I don't believe in before and after pictures. We're all a series of befores, and our befores are always beautiful, right? So it's beautiful to more beautiful.
Right. No, I mean, we're very fortunate. I mean, just like you, I mean, I've been seeing patients now for 20 years, and it's really a special how we develop these long-lasting relationship with our patients, and then we get to know other family members and friends, and when big events like, I know your daughter's getting married later this year, Sabrina, right?
Hopefully, Sabrina, and hopefully she'll be a dermatologist.
So for something like that, when somebody's, when they have a big occasion coming up, and such as a wedding, how do you counsel them? Because this comes up all the time in terms of what's the kind of the proper order. I always get asked, when should I start thinking about preparing my skin? How do you counsel your patients on that?
Well, you start when you decide you're getting married. So the more time you give, the better. It's not something you think of doing a few weeks or a few months before. And so we try to make an annual calendar. And so we plan, we, depending on the age of the person, what their needs are, we start to figure out like longer term things that might cause some tightening, like thermage or all therapy, the ultrasound or radio frequency devices that we may do more than once. Dr. Friedman's an aesthetic artist. That's sweet. Yes, he is. That's for sure. And so we map things out. So the fillers last longer than we think. If someone hasn't had a neuromodulator, we do it early so that we can
Mm-hmm.
see how they like it. You don't want to try that 2 weeks before the wedding and then decide you don't like it, right? So you
Right.
want to have that ahead and then know that you can repeat it. But it's really about getting into a good skincare routine, proper assessment, and then just making a calendar. And then I make this thing for about a month before the wedding called Wedding Row. So anyone who's getting married gets to be on Wedding Row. So as they get to the month before their wedding, they get to come in whenever they want to be seen first. So we take the stress over worrying about a breakout or rash or something happening right before the wedding kind of off the table for them because they know that we're there. And that really helps. I also think it's a bad idea to try a new treatment 2 weeks before a wedding. That's
Right.
not the time to go for that facial or that spa treatment where they try a new mask or peel or something. They call it a light peel, but you may react strongly. So that's not the time to try anything new. I have so many brides who decide 2 weeks ahead to go with girlfriends and get something done, and it's inevitably a disaster.
Right. So I have this situation come up a lot where you have a mother-daughter who sometimes come into the office, and sometimes you get the impression that the mother's maybe putting a little bit of pressure on the daughter to, you know, where there might not be the realistic expectations. I mean, the daughter it actually looks good how she is. She's young. She doesn't
Yeah.
need to be venturing down this road. Maybe there's some feelings that are being pushed onto the daughter. How do you handle that dynamic in your office? And
Well, I always stay true to what I believe is right. So sometimes I agree with the mom, sometimes I agree with the daughter. We're navigating that line. I always come from the point of my own truth, of what I think that person needs and assessing. So one is to acknowledge what's going on, acknowledge what the mother sees, acknowledge what the daughter sees or feels, and make everyone's opinions and thoughts okay to be expressed so that people can tell me what their worst fear is, what their greatest hope is, and so we can have all that on the table. But I've learned over the years, as I'm sure you have, that I have to stay true. And there are people who want more than I'll do, and some people who want less than I think they need. But I have to stay true to my own aesthetic and my own beliefs. So a mom can express, I'll sense what the daughter wants, and then I'll try to help them find that line between them and make the connection without ever being judgmental. And it's worked over the years for me to kind of walk that line. It's tricky sometimes, but we do it.
it's very challenging. Yeah, I mean, sometimes we'll try to separate the dynamic and then talk to the daughter and say, what's really bothering you, and work that way. Um, when you have patients, we all have this as well. When you have patients who are coming in and you feel like perhaps they've had injections or treatments other places and the aesthetic is off, where they don't look as natural or
Yeah.
as you would like it. How do you handle that dynamic in terms of setting patients back? Okay, it's time to take a step back. Do you have them bring in pictures from where they were years ago and say, let's reset? And then when patients are coming to you, let's say throughout the year, how do you continue to say to them, keep everything natural, where people have a tendency to forget what they look like at baseline? Do you have a tendency to go back and show them photos of themselves when you
Oh
first?
yeah. I had and thank you, more compliments to us both. I find that taking pictures is really, really important. I had a patient who came in once who had driven 4 hours with her husband to come in. He was not very excited about her having a treatment done at all. I don't know if he just loved her the way she was or didn't want to spend the money, but that dynamic is always also complicated, right? When one partner is not supportive of the treatment. So we did a treatment very hesitantly. We did some filler around the mouth and the chin, and then she went off. We took before pictures, And then she went off and called me an hour later, and she said, I'm sitting here, my face is swelling as we speak. I'm mortified. My husband tells me I look awful, and like I don't look like all these things that got her so worried. And she goes, I think I just ruined my face. What did I do? And she's in a panic. So she was out getting her hair done. And I said, okay, we'll come back in. So here I am thinking, oh my God, what happened to this patient, and how did this happen? And, was she reacting? And all of these panic mode things go through my head. So she comes in and I take a look. I thought she looked great. I didn't see anything she was talking about. So I just asked my staff to take a follow-up picture. So it's just 2 hours later. So thank God she hadn't driven 4 hours back home. She was still around town doing some things. So she came back in and we took a follow-up picture. So she looks at the before and after. This is why pictures are so important. So she looks at the after picture, and her jaw, and this time it is an after picture because it's immediately after, and her jaw just drops. And she goes, oh my God. She had no idea what she looked like before and how much better she looked after. She was so happy. She goes, can I have a copy? And now she was mad at her husband for making her feel so bad. So there's some dynamic going on there. So she said, can I have a copy of this picture? And I said, sure. But I can tell you, if I didn't have that before picture to be able to take the after, there's no way I'd be able to convince her that she only looked better afterwards. Right? So it's the power of the photograph is so much. It was exactly the same room, same angle, same lighting, because we have a way of ghosting. So we have the exact on top of each other. And she was so relieved and so happy. And then she saw her beauty. It was only then that she could see that she had to see through her own eyes, not through the eyes of someone else who was somehow invested in how she looked. And she felt so much better. And it was life-saving for me because it was something that I think I would have felt horrible about her feeling that way if I wasn't able to show her and to look myself to see what the difference was. So I think pictures are really, really important. We take pictures all the time. We have specific consents for people who allow us to use their photos, and patients have that option. So some allow us to, and some are more private, but we always want to take pictures of patients. And we do have them bring in pictures of when they were younger, because I think that helps me see their balance. It's not that I want to make them look like that, but I want to know what their balance was over the years.
So as I said earlier, I'm a huge fan of your show. I'm always listening to it. For anyone who doesn't know, Dr. Day has a syndicated show on radio show on Dr. Radio. It goes every Thursday at.
It's Thursdays at 6 to 8 on Sirius XM 110. Unfortunately, we're on hold now because of COVID.
So 2 questions before all this, before the crisis. What were you most excited about in terms of some of the things that were coming down the line that you had? I know we're both serve on advisory boards for a lot of different companies. And, we were scheduled to speak in Nashville this summer, which it looks like that might be put on hold.
Yeah.
What were you most, what did you feel like was some of the more exciting new technologies that were kind of, because there's a lot coming right now. I don't know how that's going to change. But what are some of the things you're most excited about?
I'm really excited about some new fillers that are coming. Teoxane is coming. Revance is having, and both by Revance, they're having a new neuromodulator that supposedly lasts longer, which I think will be good for some areas. And although if you get a side effect, that's going to last longer too. So you have to be careful. And also they have some new hyaluronic acid fillers that my colleagues in Canada already have available and tell me that are amazing. I have loved the combination. I've been doing more with hyperdilute radius for areas like the neck and the arms and the body. So a lot of body work has been exciting with fillers and also with threads. So I love the Cellulite Instalift. When I say I liked it a lot. I love things for the right patient. So not everything is for everyone, but in the right person. The Instalift can be nice to help when you don't need more volume, but you want a little bit of a lift. Euro threads, I haven't used the other threads. There's Mint and Nova threads, I think, also in the right person for areas like around the mouth and even the forehead to give a nice brow lift. I was having such a great time with those two because they're relatively safer in terms of not getting into blood vessels and having those concerns about occluding a vessel, but also they offer nice results without giving more volume, but giving a lift. So we're learning the difference between lifting, tightening, adding a little bit of volume and contour, and having so many different tools available between devices and fillers and neuromodulators, we really could do so much more. And then I was doing a lot for hair as well, between lasers and different versions of PRP that I've been incorporating, and also products. So we were in such a good,
Right.
happy role, and hopefully we'll
Right.
get back to it. But
So,
it's so scary how these things happen.
it is. It really changes your perspective on things.
Yeah.
When, I know a lot on your show, you talk a lot about nutrition and the role of the importance of a good diet. And can you talk a little bit about that, how you educate your patients? When patients ask you about supplements, collagen supplements, what is your, I know there's not a lot of wonderful data out there. What is your personal feeling on that? And when you're speaking to your callers or your own patients?
Well, I do believe that food is medicine. I was raised that way. My dad always treated food as medicine, and that what you put in your body is so important. And my dad would never eat pastries or things for desserts, and we'd have cake and things around the house once in a while, rarely. And we would say, Dad, why don't you even try it? He goes, because it's not good for me. Why would I like it if it's not good for me? And he was so disciplined in that way and lived till 92, perfectly healthy on no meds, and only died because he got hit by a car. I mean, like, it probably would take that to bring him down, but it was incredible to see how much lifestyle and food makes a difference. And the more I learn and study nutrition, the more I realize that what you put in your body has a direct impact on your skin in terms of inflammation and aging and healing. So I try to be careful, and I'm not perfect, of trying to optimize what I eat, but also speaking with my patients about it. And we always practice intermittent fasting growing up in my house. We didn't call it that, but my dad always had a rule, never eat after 8 o'clock at night. And then we would eat, in the morning. So usually we didn't eat even after 6, but all of that has an impact on how your body heals and on hormones. And when you exercise, you increase human growth hormone. When you are physical, you increase other hormones, oxytocin. So we know that hormones are very tied to nutrition, to our health, to our well-being, to our emotions, and we have to make those connections. And even if you look now with COVID, a lot of what brings people down are those comorbidities that have to do with nutrition and lifestyle choices. It's never somebody's fault. I'm not blaming any patient for being sick. It's just that if we could have a greater impact on what we put in our bodies, we would be able to handle so much in our environment so much better. And we also see that difference in the skin. So I do try to talk to my patients about nutrition. I do believe vitamin D supplements are helpful. I also take something called TA65, which helps with your telomeres, keeping them longer. I do take Oracea, which is a low-dose doxycycline, which has no antibiotic effect. It's just pure anti-inflammatory. And then, and I carry something in my office too, the telomerase, and also resveratrol, which is resveratrol plus the serotins. And I think, but the most important thing is vitamin D. For the collagen supplements, that's a little bit tricky. Collagen is a pretty big protein. And if you're eating it in foods that have naturally occurring fibers that can help support collagen, it's not a huge protein load all at once. So if you have any issues with the kidneys and you're taking a lot of collagen supplements, you can stress and hurt your kidneys. You have to be careful there. But I think that some of the collagen supplements taken in their right dosages may have some impact. We see impact in the joints. I believe that is real. And we may see some impact in the skin. I always want more data, but Liquid Biosil and Skin Aid are two that I think have more data than some other ones that I've seen out there. And they may pan out to be something, but I'd be careful about overdoing it because of that huge protein load on the kidneys.
Yeah, no, everything you're saying, I wholeheartedly agree with. And it's, the role of stress can't be understated as well in terms of its impact on the skin. I mean, it's, as we see, it's just amazing the interaction between a number of different dermatologic conditions that we see in our office and stress. Can you talk a little bit about, what kind of recommendations do you make to your listeners in terms of ways to deal with stress, especially in this stressful time, to ultimately help their skin?
You don't have control. So I think one is the word stress is such a generic, broad term that we kind of put everything into that basket. So I try to break down, and that's what the book Beyond Beautiful that you were talking about really speaks to, is specific stressors. So stress that's going to make your hair fall out versus make you get a rash. These are different types of stressors for different people, and we all handle stress differently. So one is that stress isn't always a bad thing. Sometimes stress can motivate you, right? If you're stressed because you have an exam, you're going to study, hopefully, right? If you're stressed because you're afraid of getting sick, maybe you'll wear the mask more, or you'll practice more social distancing. So those stressors that are based on consequences can be positive, but we have to see them more as puzzles and challenges rather than as a stress that's going to create anxiety and be paralyzing and aging, right? Inflammatory in that way. So one is how acknowledging the stress so that you know what you're dealing with, and then it's coming up with a strategy of how to deal with it, and that helps. So I had patients who would come in, and this one woman had this like horrible rash around her eyes, and I noticed she wasn't making eye contact, and it turned out that she had something going on in her life that she just really didn't want to see. And so she just kept rubbing her eyes, and she created a rash. So it's not just that not wanting to see something is going to make a rash around your eyes, but it makes you behave differently, makes you handle that stress differently. And some people, with hair is hair is such a powerful effect on our sense of self-esteem, because when you see an animal that has beautiful hair, you think that's a healthy animal, right? Or a beautiful coat of fur. So instinctively, we see hair as a sign of health and life and vitality and fertility. And when you see somebody with thinning hair or balding hair or losing hair, we think we're not as beautiful. So even though you don't need hair to live, a lot of my calls now with everything going on with COVID is hair loss and hair shedding. People are devastated by it. And you think, we should be happy to be alive, but no, they are. That's why they care about their hair, because that's to them their sign of self-esteem and being alive. So, but there's a reason why some people have that as their issue over other things. And I think acknowledging what your concern is, what's driving it, is very helpful, because by separating it out, you can deal with it, and that helps your life get better and that problem get better. And you have to deal with both. We deal with hair. We talk about PRP and hair treatments and topicals and lasers. So I'm not saying you only deal with it on one level, but unless you deal with it on both, then you're going to miss the point. And someone's asking about my go-to foods. Go-to foods for me are what's in season, minimizing meat when possible, optimizing fruits and vegetables, and I don't think organic matters as much as fresh, and variety in what's in, and Jackie, Dr. Jackie Yee is watching. Hi, Jackie. I just got an air fryer based on her recommendation. Hopefully it'll come today, and I'm going to start cooking some things in the air fryer. So, this one thing I'm finding with this whole thing with COVID and being home is that I'm cooking more and cooking and eating earlier in the day. And that's really been, not so bad.
That's important. We talked earlier.
You have favorite foods?
You'll be proud of me. I have been a vegetarian since Thanksgiving, and
wow,
it's been a life changer. I have to say, I feel better. I feel like my skin is better.
No hamburger at all?
No, I've been.
Wow, I need a hamburger once in a while.
Yeah, well,
I'm not a purist. But, Beyond Burger is not very healthy.
Okay, well, don't tell me that now.
Yeah, I know. Sorry. Never mind. Just forget I said that.
So you mentioned
a question
hair
about Sculptra and scar tissue. I'm not sure what that question is. Sculptra and scar tissue?
Yeah, she wrote earlier. She said, she says it creates scar. We love Sculptra.
I love my Sculptra patients are my happiest patients. I love Sculptra.
Let's see what she wrote.
Giacono said yesterday doesn't create collagen. Well, you know what? He's a plastic surgeon, and I love Dr. Giacono. He's a brilliant plastic surgeon in New York. Do you know him?
I do not.
Oh, yeah, he's a great plastic surgeon. But I think plastic surgeons who do a lot of facelifts don't love Sculptra necessarily, because when they're trying to undermine and do things in the skin, it makes it a little bit tougher. So I see what she's saying that way. But I will tell you that a lot of my patients who have Sculptra, and I'm sure it's true for you too, don't necessarily end up needing facelifts if they do it over time. So it depends on what your needs are. But I love Sculptra, and my patients love it. I think it makes the skin look better. I don't know why.
Question about how much vitamin D you recommend daily.
It depends. I think 4,000 to 5,000 international units a day for most people, but you want to get checked to make sure if you're vitamin D deficient or not. That's way higher than the recommended daily dose. So recommended daily allowance. But the recommended daily allowance is the amount that you need to prevent disease, not for optimal health. So I don't always go by the RDA. That to me is just a guideline. But most people, I think, are vitamin D deficient. And now with COVID being around, having vitamin D, I think, is really helpful. It's one of the things,
Absolutely.
vitamin D, zinc, and vitamin C. But too much of anything isn't good. Too much vitamin C can cause kidney stones, so you don't want to overdo anything.
Question about pescatarian lifestyle.
It's what works for you. Some people think it's good. I think salmon has a lot of good data, but you have to hope and that you just have to know the source of the food that you're eating as well. I don't know about Dr. Gundry's skin lightening cream. I don't know anything about it.
Can we were talking earlier about hormones and postmenopausal, and you mentioned that hair loss. Do you prescribe much spironolactone for this? And do you ever?
Carefully.
Okay.
So with hair, I do about 30% of my practice has ended up being related around hair loss. It's just kind of going in that direction.
Wow.
Yeah, it's one of those things where it's sort of the path takes you down the path. I did a few things on The View and some other things, and so patients started coming in, and so I focus on it a lot. But one thing I find with hair is that it's complicated, right? There can be more than one underlying issue. So whether it's stress shedding, androgenetic, autoimmune, sometimes a combination of those, products that people may be using. So we have a lot to sort through. I don't find labs to be terribly helpful in figuring it out. Vitamin D deficiency can be an issue there as well. But we try to nutritionally optimize patients. I do like Nutrafol. I like Viviscal. I think those are incredibly helpful. Sometimes I'll use both, but Nutrafol has a lot of really great ingredients. So if I was going to do one, I'd probably do that one. It's a great cocktail. And then PRP, there's a few different types. You want to be careful not to overdo it with PRP in terms of the concentration. So we're learning about the different balance of PRP. So I have a few different systems that I use. And I have the Fotona, which is a long pulse erbium laser that has been very helpful in hair loss. And I have some patients with autoimmune hair loss, alopecia totalis, who've had some complete regrowth of hair, which I posted on my Instagram from that laser. So I usually do a combination of supplements, topicals. Minoxidil is FDA approved for both men and women in the 5%, once a day for women, twice a day for men. And then we add some other things into it like niacinamide and caffeine. So in our formulation, and then we have the laser injectables, right? And then managing the stressors. And the stressors for hair tend to be around people who are very capable and somewhat control freaks in a way. So they tend to be pulled in too many directions. Someone says, can you do this? Can you do that? Can you do this? And they get pulled in so many directions and they are not centered enough around themselves. It's a very simplistic breakdown of it, but a lot of hair issues really have to do with being balanced within yourself in ways that it's a commonality of the experience that people relate to. And oftentimes when I tell people stories about it, they think I'm being psychic, when in reality, it's because it's that shared experience that people with hair loss have.
Right.
And they're often very smart, very capable. So it's a very complicated thing, but we can make a big difference.
You have a fan from Brazil here.
Hi. I love
So let's talk. Let's go to we're going to talk, since it's Rosacea Awareness Month, how about we talk a little bit about rosacea?
Perfect.
We've been doing a lot with combination of both laser and topical vasoconstrictors. The predecessor, we had issues with patients with rebound erythema, which was a big concern. But more recently, we've been using a lot of topical Rhofade. So for those who aren't aware, it's a topical vasoconstrictor. We typically recommend applying it in the morning, and it lasts throughout the day. So for patients who have stressors that may exacerbate redness, it helps to reduce that redness throughout the day. And then typically after patients have been on a course for usually about 4 weeks, then we'll recommend laser therapies, most commonly the pulse dye laser, which is a vascular specific laser that specifically targets red. We use it on 5-day-old babies with red birthmarks. And we commonly use it in patients with rosacea who have concerns of redness, telangiectasias. Maybe they are bothered by flushing or a burning sensation. And we typically do a series of those and then do a maintenance treatment, usually once or twice a year. How about you, Dr. Day?
So very similar with rosacea, we go over the triggers because it's different than acne. So we know it's not bacterial. We know it's more inflammatory. So triggers are stress, extremes in temperature, drinking alcohol, and heat is a big trigger. So we try to review what the triggers might be to help them recognize what their own triggers are. And sometimes you have a personal trigger. My personal trigger is vinegar. For some reason, that's what does it for me. And so people may have their own personal triggers. So we try to identify what things might be triggering their rosacea. With all the stress out there now, that's a perfect trigger. And then we talk about treatment. So topical ivermectin, Soolantra is the brand name of that. I think it's out both brand and generic now. Metronidazole topically has been amazing for rosacea. Sulfa-based medicines. We seem to go after this Demodex theory of rosacea where this certain little mite called Demodex is overgrown. Now, some people believe that's true. Some people don't believe. It's a little thing that we have amongst ourselves in the derm world that we go back and forth with. But the treatments that we use for rosacea are mostly antiparasitics. And that may be because of something in the skin, or maybe it's a side effect of those medications. But the topical ivermectin, topical metronidazole, and even sulfa-based seem to balance out something in the skin, and they work wonders. Rofade is one that is FDA cleared to reduce the redness of rosacea for the day, so temporarily reduce the redness of rosacea. And for patients for whom redness is the main concern, it's amazing. They love it. It lasts. They don't tend to have that rebound, so they don't end up redder at the end of the day once it wears off. And it just can be life-changing for someone who is really embarrassed about the redness.
So question about, do you find topical ivermectin useful for all types of rosacea or only pustular papular?
So it depends. Some people do have some, and topical azelaic acid is also quite good, even for the redness. So for the redness, if you only have redness, it seems that something like Rofade is the best thing. If you have a breakout, the acne type of rosacea, then the other ones, the topical ivermectin, the topical metronidazole, and sulfa-based, I usually use it as a cleanser, tend to be better. And they don't seem to do as much for just pure redness as they do for redness along with the breakouts.
Yeah, I agree.
And then, of course, sun protection is important.
Right. No, it's amazing what a difference we can make with the interventions that you discuss for these patients. I mean, we've really come a long way in our ability to treat rosacea.
Yeah, still annoying.
Skin tightening for aging neck.
That's a tough one. I like the erbium, the Phytona Dynamis. That's a laser I like. It's a combination of an erbium and ND-YAG, and then also thermogenol therapy, radio frequency, ultrasound. There's lots of things, but also skincare is really, really important. And some fillers even help with that, and neuromodulators. It's really a combination of things. So we want to address collagen breakdown from sun damage, skin laxity from just volume changes over time. And then we have to decide if any of those will work or if it's really just a surgical option. And sometimes filling the mid-face will give a nice lift, and that makes the neck look better. So sometimes to make the neck look better, you have to go above and sort of share that energy back up along the jawline and the neck to try to help with the lift. And that makes the neck.
And we also do a lot of ablative fractional resurfacing, which
great.
Helps with skin texture. You see a little bit of tightening. But
I think
helps
it's
with sun
significant
damage.
Tightening. You know, a little bit of tightening in the neck can be quite powerful.
Exactly.
Because don't you see patients who end up getting a lower face neck lift and they come back a few years later and they say it doesn't really help, and then you do a tightening procedure. So someone said they had something and it didn't help at all, but I think it's really just having that combination. We're not aging in one dimension. We have to address it in more than one dimension. So it may not be that one treatment of one thing alone is going to give you that result. It's doing one thing, combining with other things so we can affect all the different aspects. And it's work. So someone saying thermage doesn't work, it depends on who does it, what your underlying issue is, and what your expectations are. So in our office, our patients who get thermage are thrilled. And we have before and after pictures. I mean, they're really, really happy. So it may not have been the right thing for that person. And we always hear these mixed things. That's the problem, I think, with some of the things I see on Instagram and social media is
And real self as well.
yeah, is that I think that you sort of need to have expectations managed to some extent, and to know that it's going to be in more than one dimension. So that's a conversation the person should have with their doctor for sure, and know who's doing the treatment. In my office, my nurse does the treatments, and she's just incredible at it. So do you do it in your office?
We do. You're so amazing in this format. Do you envision doing virtual consults? I mean, I just feel like for you, I mean, you're just so well spoken, and I think we haven't had a chance to talk about what our practices will look like moving forward, but we have been doing. I don't know. We've been doing virtual consultations, and patients have been responding well to it, and I think ultimately, our goal is going to be reducing flow into the office and cutting down on the length of the visits as well. Do you envision this type of format for new patients? Maybe it'll cut down on the amount of traveling that they're having to do as well to come see you.
Maybe, but I like to be physical. I like to be right there with the patient. So we're doing some telemedicine now, but I find that when I'm in the room with someone, for me, it's a much more powerful experience. So my hope is that we're going to figure this out and either have really great treatments or a vaccine or a better understanding or herd immunity or something, so that we can not have to live like this, because this is not sustainable. Right. Living in New York City, not being able to go out and having everything closed down or having to maximally social distance is just not sustainable. So fortunately, because this is a worldwide issue, a lot of very smart people are working all at once and working together to solve it. So I'm hopeful, and I'm an optimist by nature, but not a Pollyanna. So seeing and reading about this all the time, I am seeing a lot of signs of promise that we're going to get ahead of this soon, and we'll be able to get back to life as it should be, which is face to face.
Right. It's also really hard when you're engaging with the patient and you're wearing a mask. I mean, I really was, before our office closed and we were all wearing masks, it was really challenging, especially with new consultations, because so much of it is how we interact, and the dynamics, the interpersonal dynamics are lost when half of your face is covered.
It's true. I mean, so much of communication is nonverbal, and if patients can't see what you're feeling and thinking, then it'll change the understanding. It's like typing and texting. When we added emojis now to try to communicate an emotion that goes with it, so people can understand our context. But having a mask on, one is it's hard to breathe. So people talk about wearing masks all the time, but it's not that easy to breathe with a mask on. And two is that you do lose a lot of very important nonverbal communication. And even when I'm injecting or treating, patients look to see my expressions, to get a sense, like, as a mirror of what I'm feeling. And that's, I think, important. So hopefully we'll get back to that soon. I think we will.
So a question about Cellulite. Are you doing work with Endo Aesthetics?
Yeah, I'm on a lot of their advisory boards, as I know you are.
Can you talk a little bit about how it works and what you've seen in the clinical trials?
So I'm just following the public data. I'm not part of the clinical trials. It looks like it does work, but it's affecting, Cellulite is complicated. So it's going to help with certain aspects of cellulite. It will take a few treatments, and the results are lasting. Patients are happy, but there is some downtime in terms of bruising, and so we'll see how it goes. But I've been impressed with the data. It's just a matter of if it's going to be enough to make people happy and what the costs around it will be, and that stuff we don't know yet.
Right. I was just speaking with them, and I think there might be a role for doing some pulse dye laser treatment after the injections to help reduce the bruising. That makes sense. Yeah.
That would be amazing, because I think that's a big factor. If you have to limit it because of the bruising, But you know what? They're being really super transparent about all of it. I think the company is incredibly reputable in how they're trying to get the information out there. So I think it's going to be another approach. And for people who are bothered enough by their cellulite, it's nice to have another option. Because I don't do Selfina.
You know, I'm sorry, I lost you.
I'm not doing Selfina in my office.
Okay.
And Selfina is more for the deeper divots, and that's more mechanical. So I don't know. We'll see. I'm hopeful that we'll have a nice new tool.
Right. Should we show some pictures, or how are you on time? Or this has been great.
I have a few more minutes. I'm not sure. I've never shown pictures before. So how do you show a picture?
So you want to show?
Oh, wait.
Is it?
Let's see. I'm trying to figure out how to show a picture.
So there's a picture icon in the bottom right corner.
The bottom right corner.
We can show.
That's sending.
You want to show?
I see the picture icon, but it's mostly to make a face. See, like that. So I don't think I want to do that. Although I think that's not so terrible. Oh, this is kind of fun. Okay. So I should have done this all the way through. Go ahead, show me.
Can I show you a picture?
Yeah, sure.
Okay, let's try it. Let's show the Fraxel picture. You look good there.
You know what? I think I might keep this one. This is like a beauty shot. I like that better than how I look. Okay.
So this is a patient who presented obviously light complected. You know, a lot of patients with fair complexion are more susceptible to sun damage. And it's interesting, you know, we oftentimes will see patients in the office, and it's not uncommon for the left side of the face to show more sun damage because it's the driver's side. And we do get UV exposure even with the window. UVA can penetrate through glass. And there's a really fascinating picture of a truck driver who's been, you know, was a truck driver for years and years. And the left side of his face looked about 20 years older than the right side of his face. So it really, you know, can't underemphasize the importance of protecting your skin. But this patient had some mild to moderate signs of sun damage with some fine lines, some soil intigos or sunspots. She also had some precancerous lesions, which you can't visualize. And so what would be, if this patient presented to your office, what would be your treatment protocol that you would recommend for her? Let's say she's in her mid-50s.
So I would definitely do topicals, topical brighteners. And so I'd use a retinol, growth factors, maybe some hydroquinone, and some, and I like the TNS Essential Serum, and I would use a retinol for topical for sure. Then I would do a series of Fraxel lasers.
That's what she had. How long?
And I would do the thulium.
That's exactly what she had. How long would you do the skincare before you recommended doing the laser?
I also like elastin, the elastin nectar.
Right.
I would do that depending on how much time we had. So if she was there one day and wanted the treatment that day, I would do it the same day and then do the treatment after. If she came in and wanted to plan it, then I would start the treatment right away and do the laser whenever she could get in. So for me, it's not that I believe you have to prime the skin, but I use it because the Fraxel thulium I do is a series anyway. So I find that it's important to start the skincare at some point. The earlier the better, but it's not a deal breaker if they wanted to do the treatment the same day. I also find that what I do right on top can make a very big difference. So I often right after do something called Callicin, which is growth factors, and even some topical Sculptra right on top after the thulium, and then we put a mask on. So I try to optimize my opportunity of having created that wound to drive some elements into the skin, even into the superficial layers if I can, which I think can either help stimulate collagen, at worst do no harm, and at best optimize the outcome and make this treatment super. So, and I'm always working on my little secret sauce of things that I use on the skin to try to optimize the outcome. But I think that's what sets us apart, is that we understand the science, and we're going to pick ingredients that are going to help optimize our outcome.
that's exactly what we did. So she had the Fraxel laser, and there's a question here about downtime. So we would typically, probably in this case, recommend 3 treatment sessions. We would do them at monthly intervals, and we would typically expect about 4 to 5 days of downtime. You get a little bit of redness, and you get some mild swelling, and you can expect some flaking of the skin. So it's more social downtime.
Right.
Patients,
Barely, right?
right. And what's nice is during that time, you can cover the skin with makeup. And it's just really critical both before and after the laser procedure that you're extra careful about avoiding the sun. We don't treat tan skin. And so it can be challenging during the summer months. But a patient like that just is with the technology that we're able to both safely and successfully treat, and also with really minimal downtime. And so it's really gratifying when a patient like that comes in. But I think it's also important that we counsel them on measures to prevent further sun damage. Patients like that often tell us that they have a history of tanning bed use. And so, and it's not uncommon, we'll talk to patients and we'll be like, have you had a history? Have you had a skin exam recently? And it's not uncommon, once we get them in for a full skin exam, that we might detect skin cancer as well. And so, as everything you talked about earlier about the mind, and looking at the entire picture, I think is really critical, because a patient like that, it's not uncommon for there to be other issues and sun damage and precancerous lesions that we need to treat it as well, and it's important to address those.
I agree, and I tell them they can wear makeup and go out the next day after Fraxel. I don't have them stay indoors. I say follow your skincare, but the day after Fraxel they can go out and about. And I tell them they'll look sandpapery rough, that their skin will kind of, at day 4 or 5 it'll probably be the most flaking, but it's not like a fractional CO2 in terms of the downtime where they really literally have to hide for a week because they'll scare people. So it's not like that.
So there's a question on number of passes that we do. I mean, in my hands, it's all about kilojoules and how much energy you're delivering. It's about the patient's skin type. It's about setting expectations in terms of how much downtime you want. I was on a call with Jeff Dover recently, and they in Boston, and they have a very busy laser center, and he was talking about they have this procedure where they'll just do 1 or 2 passes, just do a very light peel for patients who want to go right back to work. And so that's a conversation that has to be individualized and tailored based on the patient's skin type, expectations, and what kind of downtime they can handle.
Absolutely. I agree.
So questions between the Luminous and the Fraxel. Do you use any of the Luminous device?
Yeah, I have the Resurfix, and it's different. So the Fraxel is a thulium. The Resurfix is a different wavelength. I'm trying to think now. I use the Resurfix for cellulite. I do use it for some rejuvenation as well. And it has, depending on the amount of energy used, about the same amount of downtime. But I tend to use the Fraxel more. I don't use the Resurfix for brown spots. I use it more for collagen improvement and rejuvenation, but not as much for downtime. Now, the Resurfix also does have a Q switch on it, which you can use for brown spots. And in that sense, it's similar to the Fraxel, but I don't usually do that for the whole face. I'll do that for a particular lentigo or something that I want to get rid of more as a kind of a spot welding around a Fraxel treatment.
So a question about lip lines.
So lip lines are tough. One is I look at teeth and dentition, because if you have volume loss in the chin and you have a receding of the lower, then when you close your mouth, you pucker more, and that makes upper lip lines. So I find that one is I have to look at the anatomy very carefully to see what the resting position is, and adjust that. So a lot of times to help upper lip lines, I have to add some volume to the lower lip and the chin and bring that forward a little bit. And then the lips sit better on top of each other, and then that relaxes those lines. Neuromodulators can help if someone has just a habit of puckering. It can relax those lines. I like Euro threads to help smooth out and add structural support without adding volume. And then again, some fillers can be helpful. And even fillers in the midface, even though it doesn't directly help there, it takes the energy off that collapse, which will then make you not pucker when you sit, because it's that dynamic discord. It's when you're sitting at rest, you're actually making an expression and using muscles without intending to, and that exacerbates those lines. So it's really about understanding the root cause of the wrinkles, not just chasing them.
Now, your husband's a dentist, is that correct?
Yes.
So that's so do you guys share a lot of patients?
We do, and I find that because I've gone to so many of his lectures, I get the dynamics between dentition
I couldn't agree
and
more.
anatomy, and it's incredible how much your teeth affect your lips. It doesn't matter how much filler we put in the lip. If you don't have good structural support from your teeth, then your lips will never look right and never look balanced.
In my practice, it's the grinding. I mean, I would say 80% of my injectable patients, and they don't even realize it, are teeth
Yeah,
grinders. And
yeah.
so the difference we can make in terms of we'll put some Botox in the masseter muscles here, and then we'll talk to them about getting them in to see a good dentist about wearing a mouth guard. I mean, and the
It's the
role of
masseters, the pterygoids, the temporalis. Like sometimes it's even coming from up high where their energy and the stress is coming from. And we have to feel all three, and there's superficial and deep muscles. So this is something that is so powerful and so important because that'll wear down your teeth will shift, you'll have headaches and other issues and bone loss and bone change. So it's really important, one, to preserve the shape of the face, but two is to preserve function. So I agree with you. Hi, Ellen. Ellen Marmer's on with us.
hi, Alan. We also have Matt Abram.
Hi, Matt.
Yeah, no, it's life changing for these patients, and these are my most typically the most loyal patients because as soon as it wears off, they're back in your
Yeah,
office.
I've
Uh,
been getting those emails too. Someone's asking the kind of threads. I use Euro threads. I don't have any interest in the company. I love those threads.
let's
All
see.
right.
How are you on time? You've been so amazing. It's been almost an
Thanks.
hour. I don't want to
I know.
keep you. I know you're a
Unfortunately,
busy
I have
woman.
to go.
So can you
But this
just
was
real
so much
quick,
fun.
can you just tell us the experience of what it's like when at 7 o'clock when the shift workers are leaving and everyone is expressing gratitude? Can you give us, for those of us who only can see it on TV, what that experience is like?
Yeah, so the hospital is right behind me, right across the street, like literally right outside my door. And I grew up here, so I've lived here my whole life. And every day when those sirens go on and you see people out there applauding and the doctors who come out or the nurses and healthcare workers who come out, it takes my breath away every day and it brings tears to my eyes to see how hard they're working and what they're going through on those front lines. It's an incredible job. And Ellen Marmer's husband is also a frontline worker, so shout out and thank you to him and to her for all that she's going through. I know it's so anxiety provoking, but it is a beautiful sight every day to see the gratitude and hopefully the recognition of what it means to be a doctor right now and the differences. So everyone has a powerful role, but there is a difference between the different specialists, right? And the work that we all do. So it's incredible, and
Well,
hopefully we'll be done soon.
I hope so. Thank you so much. It's
Thanks
always
for
so
this is
nice
so
to
much
talk to you.
fun. I'm
This was
glad I
great.
found this filter. I might keep it.
Yeah, you'll have to teach me how to do that. All
Just
right.
swipe.
Well, stay
Bye.
safe. Bye
You
bye.
too. Thanks, Paul. Bye.
Bye. Okay, now what do you do?